Elvis Presley, Marilyn Monroe, and now Michael Jackson. Celebrities with one thing in common. Their sudden deaths may have been caused by misusing pain prescription medication. August is National Pain Awareness Month, and organizers say the goal is to provide education about the proper use of pain medications for both patients and healthcare providers. Joining us this morning is Dr. Alexandra Dratsoon. Thanks for being with us.
Thank you.
Obviously, the Michael Jackson case really helping to bring this to the forefront now.
Absolutely. We're finding that painkiller medication is the second leading cause of accidental death in the United States, and chronic pain can impact adversely a person's mood, their relationship with their family and friends, their work, their financial situation, and their overall quality of life. And at some point, all of us are going to experience pain, and we'll need to know the pain management options that are available to us. So it is a relevant topic for everyone.
And is that part of the problem, that people maybe don't understand their conditions and the options that are available to them?
Yes, that is one of the concerns is there are other options available besides taking pain medication. We do have alternative and complementary therapies. Alternative therapies are there to take place for traditional medicine, and then we have complementary therapies which can be used in conjunction to traditional medicine.
And what are some alternative therapies? Because there's plenty out there. People don't necessarily have to take the pain medication, certainly for long periods of time, right?
Correct. It depends on the person's medical condition, and they would have to consult with their medical doctor in regard to that, but we still are having research conducted on some of the alternative therapies. Some are more research validated than others. For example, we do have acupuncture, in which involves the acupuncturist inserting extremely thin, long needles into specific points along the body to treat pain. We have biofeedback as well, which involves teaching the person to recognize visual or sound cues in controlling their biological response to pain or stress. We have guided imagery. We have hypnosis, which is also research validated. We have herbal medicines and supplements.
And chiropractic?
Chiropractic manipulation, which includes correcting any spinal misalignments that may be contributing to pain as well.
Possibly help relieving the pain. And you say there are 6 steps that people need to remember when taking chronic pain medication. What are those steps?
Those steps would include, one is, do not take pain prescription medication unless it is prescribed specifically for you. Each of us has a unique body chemistry, which we will respond differently to medication. Secondly is, never mix a pain medication with alcohol. This can be a deadly combination.
Yeah. Seems obvious, but we see it happen way too often.
Right, it increases the toxicity level of the pain medication.
And then we talk about if the anti-anxiety or the sedative, people don't realize how potent these are and how dangerous they could be.
Right, they're very strong medications along with the pain medication, which is also quite strong, and so combining the two increases the toxicity level of the pain medication in the blood in the person's system, so they can be fatal. And if the person must utilize the sedative or anti-anxiety medication, it's important that they consult with their doctor, even run it by their pharmacist, to make sure that there aren't any harmful interaction effects.
And we hear the other one that was on the screen, we hear about this way too often, where people use medications as a sleep aid. Pain medications.
Yes, because oftentimes pain can make it difficult for someone to fall asleep or stay asleep, and if a person has a condition of sleep apnea in which they stop breathing during sleep, this can also be fatal.
OxyContin being one of the ones that I know a lot of people get addicted to, because it's highly addictive if you just take it a few times, right?
Yes, it can be, depending on the person. There's a lot of different factors that influence addiction.
And, again, you really want to get off the pain medications as soon as you possibly can, depending on the severity of the condition you have.
Right. If it's possible, then it is better for you, because there are a lot of side effects that somebody could encounter due to taking pain medication that might include constipation, impairment in mental function, and drowsiness, which could affect their ability to work. We also know that a person may stop producing their own natural painkiller, which are endorphins. They might develop a tolerance, require a higher dose.
It's just bad, overall, bad for your body if you're going to continue on a prescription drug for a long period of time.
Right, it could cause problems in other organs of the body. So, I mean, if possible, if there is a way to wean off of it and utilize another natural approach, it would be more beneficial.
All right, Dr. Alexandra Dratsoon, thank you so much for coming in. Some great information. If people want to get in touch with you, there's the address and the number you see on your screen, 858-792-3541. Thank you very much.
Thank you.
All right, of course, for more information, as always, you can go to our website, san diego6.com.